Welcome to The State of Us.
Beyond mainstream cable news and party lines, with a millennial and a boomer, The State of Us pushes past the noise and uncovers all the issues that matter.
Here's your host, Justin T. Weller.
As states across the country move to keep more than 100 million Americans in their homes, a divide has burst into public view, with the White House raising concerns over the impact on the economy of the coronavirus, according to the New York Times. Stocks on Wall Street have dropped again as Washington remained deadlocked over a stimulus package to shore up the economy. And what we're talking about today on The State of Us, less so the particulars of the coronavirus itself, and moreover, some of these economic proposals that have been put forth. Some of these are Republican ideas, some are Democrats, some come from the states, and some are from the Fed. But we're going to look at all of this, especially in segment 2 and 3. We're going to talk about tax day being moved back, this idea of providing some sort of basic income to Americans during this time, mortgage foreclosures being put off, the possibility of federalizing manufacturing, and the possibility of printing money. So there's a lot on the docket. But of course, we couldn't begin this critical conversation without
True Chat senior historian and an educator of more than 30 years. Here is your friendly redneck liberal, Lance Jackson.
Should be an interesting discussion today, as we're not looking at all the social distancing and those types of issues, but instead, how is this health pandemic affecting the economy? So looking forward to it. So what's first?
So we're going to talk about, Lance, the state's role versus the federal government's role. And hopefully you help us understand historically kind of how that's come into play. Because the one thing I shared this with you before we started today when we were having our kind of pre-show discussion, that I think part of what's become illuminated, I was talking with my fiance the other day about, is this idea that we seem kind of fragmented right now, right, in our approach to this. Different states are doing different things. The federal government's involved in some places and not in others. And there's a lot going on in that regard, and it kind of makes it feel like we're more like 50 little countries than one single country. And so I think what we want to start by talking about, like I said, we're going to talk about some of those particular policies in the second and third segments of the program. But at least initially here, I think it's important that we take a minute and talk about, what do you and I see as states and the Fed's role in a time like this, in a crisis like this? Who should be doing what? And why is that? I think that's where we have to start.
Well, I think we're seeing a void being created by the federal government by, for whatever reason, a lack of action. And so therefore the void is being filled by the states, and where states aren't filling the void, then we see municipalities doing it. Take, for example, the idea that the federal government has been slow to decide, if at all, to discuss even the idea of closing everybody in and keeping everybody away from each other. So we saw where different states began, Ohio here being one of them, the governor taking the lead and closing down schools, and then saying restaurants could only be open for carryout and no groups larger than 50, to then the San Francisco area saying, you know what, we're going to put all of our 6 million people basically on some kind of, lack of a better term, government lockdown to stop people from socializing at all. So I think, though, as we discussed, that the reason we're seeing the cities and the states doing so much is because there hasn't been that leadership in these areas by the federal government. So then that's allowed the states and the municipalities the opportunity to make decisions on their own, rightly or wrongly. When there's not leadership from the central government, then it allows the smaller governments to move in and do what they deem necessary to protect its citizens.
So, I mean, I think one of the things here, and I agree with you, part of why we're seeing what we're seeing is states and local municipalities, right? They're going to, if they're not getting direction from somebody higher up in the government, I mean, they're going to take action on their own because they're the last line of defense for the most part, especially city governments, right?
Exactly. Or in this case, the first line of defense.
Yes. Yeah. And so I think the challenge here is, and this is the balance that I think has yet to be struck, is, the component and the advantages of the local response, because obviously what New York needs versus what Urbana, Ohio, where we record from, needs are not at all, going to be the same thing. Now there's a lot of similarities, some of the basic things, and that's the balance between the Fed should, I mean, in my perspective, because again, this is Lance and I are trying to share with you our thoughts on this. From my perspective, the Fed should be outlining the things that we know are universal, right? That across the country we need to be doing. And then you leave it to the local governments to communicate up the chain what they need in their respective areas based on what they're seeing and what they're going through. I mean, to me, that would be the way that you approach this, because you don't want to go too far and not give any flexibility to your local governments. Because again, they're going to face different problems based on where they are. It's not just, the healthcare system that gets faced with problems. It's food and general living supplies that people are faced with, and the economic side of it. So I do think there's some universal things you can do. Like you might be at the point, right? There's been some health experts that have said the thing to do may be a nationwide, stay at home order for non-essential businesses, and their employees. So there might be some things like that you could do that make sense from the federal level down. I think the problem right now is we don't have that balance, Lance, at least in it. That's my take anyway. I don't know if you feel the same about what role should be, what it should look like versus what it is.
Well, I think your point's well taken, but I still think that the federal government needs to lead and say, okay, we are going to do these things and we're going to provide these services and we're going to make these rules. Now, in your situation, if you need to act further, please go ahead. And unfortunately, I'm not sure we're even getting that directive from the federal government. We seem to be more worried at the federal level about the economy than we are about the health of the country. And I think they go hand in hand. That is, if we take care of the health pandemic, then the economy will bring itself back. Before
we move into the specifics of some of these economic relief items that are being proposed, and that's again what the second and third segments of our show today are going to talk about, I think we want to take just a minute, Lance, and talk a little bit about the historical precedent here of some of what we've been through in the past. And it has been a while. And I think part of understanding the crisis that we're in and why some of what's happening is in part because there's not all that many experts alive today that actually managed and went through a pandemic like this before. There's only a handful of professionals that are still actively working in the field that can share that knowledge and experience. So part of what you're going through is that. But I'm wondering, Lance, is there anything else you think people should be aware of here from a historical standpoint?
Well, I think part of the problem is when you're dealing with these kinds of health issues, it's an issue that you can't see, right? I mean, for the most part, unless somebody is very ill, when you're walking around, you can't see whether or not somebody has the flu. And I think that makes people a little bit leery of what to do or how scared to be, because when I'm walking down the grocery store aisle or if I was out, in a movie theater at a school that was open, how do you know who's carrying and who isn't? Whereas in a lot of other issues that the government has to deal with, we can see the enemy, we know who the enemy is, and that makes it a lot easier to fight.
Well, and this is definitely something that, that we have in common with, even though, we're many years later from 1957 and 1968. One of the challenges then was the same thing. It's difficult for people to wrap their mind around because, again, as you pointed out, it's an enemy that you can't really see. And so that's part of the challenge. So coming up, we're going to look at, we know this is a problem. We know the world is facing this here in our country and abroad. But specifically in the United States, there's been some economic policies put forward, suggested, and implemented that we're going to be looking at. Tax day has been moved. If you haven't heard, should it have been moved? That's what we're going to be looking at next. And $1,200 payments to all Americans. Should you get that? To find out, keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
Economic concerns abound as the coronavirus crisis continues to escalate, not only in the United States, but around the world, and especially as it's been ramping up here in recent weeks across the United States. Markets have definitely taken a hit. Part of that, and a big part of our conversation today, focuses on what the federal government of the United States of America is proposing to help ease the pain of what we're going to go through economically. There's no doubt it's already taken a toll. It will continue to take a toll, probably for many months, if not longer. But there's a lot of specific things that have been tossed out there. And so our goal today is to make sense of some of these have already been put in place. So we want to make sure that you understand what they are, but then also talk about, are these the best things to be put in place? Are we happy with them being put in place? What else could be put in place? And this is where your feedback and engagement with us is critical, because that's part of how we make these conversations valuable for everybody. So let's start with tax day. If you haven't heard already, tax day has been moved from the typical April 15th filing deadline for individuals. It's been backed up to July 15th. This is not only the filing deadline, but it's also the payment deadline. So that means from a federal tax standpoint, keep that in mind, federal tax standpoint, if you don't file and if you don't pay until July 15th, there's no penalty. Unlike if you were to file a typical extension, you would still be obligated to pay interest on any of those taxes that you owed and possibly penalties. So in this case, it's no penalties and you don't have to do anything. This is an automatic thing. You don't have to ask for it. You don't have to file anything. You just officially now have, if you haven't already filed your personal income taxes, you have until July 15th. I think, Lance, right? The thinking here is that this lets people keep some money in their pockets maybe longer, if they were looking at a tax obligation. And it also is a practical thing, right? From the tax preparer's standpoint, the whole accountant industry. Clients can't come into the office right now. A lot of these people might not even be in the office. So you're having people work remotely that have never done that before. So maybe a lot of it's a practical component, not just an economic one.
I think you're right on both counts. I myself prepare my own taxes, but I usually go out and buy a program that I use, and I did not get out and buy it. And now it's as of yet, and now I don't want to go out and buy it. So for that reason, I'm glad from a practical standpoint that I don't have to risk getting sick to go out and to buy my tax program to get it done on times. And I think too, we obviously we don't want people meeting in a closed cubicle like that for an extended period of time, transferring paperwork and information to try to get their taxes done. I'm not so sure. Yes, it lets you keep your money. And one thing to point out, as one of the articles did, that is that if you're pretty sure that you are going to get a return, then by all means go ahead and file now so that it can be processed, if at all possible, and get your money. Like if you do it yourself and you can avail yourself of the proper paperwork, send it in, because now you get your money and you can spend it. From the other side though, if we wait till July 15th, then that just means April 15th, 2021 comes around a little bit quicker for people. And so is it better to put things off, like that as far as it goes? But I think for the reasoning or the rationale, which really hasn't been stated, I think for the reasons you've brought up, that it's worthwhile. And, to point out again, though, for those of us who live in states or municipalities or school districts that require taxes, at least right now, those things are still due April 15th.
So I agree for the most part. I think this is a relatively straightforward and simple one. Everybody still is going to have to pay their taxes. We're not getting out of it. So the government's not going to be shorted that money long term. The only, I guess, the immediate downside that people have to understand is, upwards of $300 billion that the federal government would have brought in is going to be delayed. Which is to say,
they're not earning interest on it or investing it, so there is going to be some loss, but you hope then that it's picked up because 9 months instead of 12 months later, they're going to be collecting again.
Right. So, there's definitely a loss, but I think the positives outweigh the negatives. I think it makes sense, and it's a practical thing too, which is moreover the point here. Yes, there's an economic benefit probably for the individuals, but I think the bigger thing is that there's definitely the practical side of, you don't want to make people choose between going out and seeing, a tax preparer or purchasing a program or something in their health. If you don't have to.
Psychological.
Sure.
Right. It's also psychological. All of a sudden, something that's coming up within the next 3 weeks, you can now put on the back burner. Well, I don't have to worry about that. So it allows you, it takes a little bit of stress away, and it's something that you can put aside so that you can focus on, I think, more important things. And that is your personal health and the health of your family.
So let's talk about this next one, which is actually tied to a package that, at least at the time that Lance and I are going over this episode, we don't know. It's still kind of in limbo, and the specifics aren't released yet. But this is this idea of releasing $1,200, providing $1,200 to, millions of Americans. One of the things that's not clear is who's excluded. It sounds like it's one of those to most Americans. This kind of idea of what Andrew Yang in the presidential primary had talked about, which actually Lance and I started talking about probably 2 years ago on the State of Us, the concept of a basic income, which is, regardless of who you are, you get blank from the government. And interestingly enough, this was actually something proposed by Republicans, which is a little contrary to what most of us would usually see coming from that party. But it's basically the idea that for most Americans, you would get a check for $1,200 from the United States government. And this is, again, tied to a larger package, approximately a $1.6 trillion economic stimulus package that the government is still kind of hammering out and trying to figure out right now. And so I guess, Lance, the bigger question here is not so much
the majority going to businesses. So let's not pat the Republicans on the back too hard.
Right. Well, I'm not saying, I haven't said this is even
good yet. We're going to give $1,200 to individuals if we get billions of dollars to hand out to businesses without any strings attached and without having to be transparent.
Yeah, it's being held up because the Democrats don't like the essentially no strings attached to the corporate money that would be handed out. And I guess the distinction here that's important is because there's a lot of things in this, and we're not going to break down each of them today. And the package, aside from the package, isn't, again, at the time that Lance and I are talking about this, it hasn't all been hammered out. It hasn't all been announced. So, we don't know for sure exactly how some of these will play out, but that's the main sticking point is big money to big corporations. Because again, another part of this that's been discussed is payroll loans to small businesses so that they can keep their existing employees on staff, those being companies with less than 300 people working in them. And again, I think you're probably right, Lance, if it had just been the payout to Americans, that $1,200, and it had been just the small business loans, and not the big business, like the airline industry in particular was one that, caught a lot of flack and some of the bank stuff they've been talking about, because it's very reminiscent of, I think, what a lot of people were unhappy with in 2008, right? Which is kind of this totally unrestricted bailout. I mean, I know there were technically some restrictions in place, but if we're being really honest, it was mostly just, right, here you go. Here's money. And do whatever you want with it. And the problem is that the thinking was, well, if we give them this money, then maybe they'll take care of their workers and they'll, do this. And it's like, well, they didn't really do that though, because we didn't put any restrictions on it. And
well, historically, here's what I'd like to see them do. And this is from Dr. Francis Townsend, who was the forerunner of the National Social Security in California. He had the state of California introduced a bill and said, everybody gets X amount of dollars every month. If you want to get the money the next month, you have to turn in receipts that prove that you spent the entire money. Because the problem is, we don't want people to get money and then just hang on to it in case things get worse. The whole idea of keeping the economy going is that when you get this money, is that you spend this money. So I would think in today's ability with credit cards and bank cards and things like that, that it would be a great idea to put money on a card for people. And then if at the end of the month they had spent that amount of money, then they would know that they were going to get that amount of money again. I think that's a better idea. It has a little bit of a historical perspective to it, and it would continue to stimulate the economy as long as it needed stimulated. In that once you didn't need that money anymore, then you didn't spend it all because you didn't need it, then it would stop. But just to give somebody money in a one-shot deal, what if this lasts 6 months? Well, we gave you $1,200. That's not really going to do the individual or the family any good, nor will it do the economy any good.
Yeah, and I think that's one of my main rubs with what I've heard so far about the stimulus package in general, Lance, and this is lawmakers across the board in Washington, is that we're not getting a lot of particulars on a lot of it. It feels like they're quote unquote rushing and they're not actually getting anything passed anyway. And a lot of it's going to be stuff that we have to go back and patch up because it's not, it's either not going to be long-term enough, like this $1,200 payment, which sounds nice, but as you outlined, if this goes on 6 months and you can't work for 6 months, $1,200 probably, that's probably not going to cut it.
For drop in the bucket.
Yeah. But that said, there's some unemployment stuff in here too. So my guess is Lance and I will definitely have another episode specifically on the stimulus package if and when it ever gets agreed to. Hopefully there will be some more particulars at that time. So we've still got more to talk about though. We're going to look at mortgages, what's going on there, and rent, along with manufacturing. This is an idea that's been floated some, but hasn't actually gotten any real movement in the administrative branch. This idea of federalizing manufacturing, because as you've probably heard, there's a big shortage of medical masks, ventilators, medical gloves, and other supplies. Should we federalize the manufacturing system? To find out, keep it here on The State of Us, and we'll be right back.
We are The State of Us. Here's your host, Justin T. Weller.
Tax day has been moved. Payments to Americans, something along the lines of a basic income, is on the table in Washington, but the deal's being held up by party politics. We're looking at next in this segment of the program, federalizing manufacturing, mortgages and rent, and what the Federal Reserve is doing. So this first one, Lance, is an idea that's been kind of floated because legally the administrative branch of the federal government, right, the executive branch, has the option, that being the president, to basically essentially federalize the manufacturing companies across the country and order the production of different materials and goods in a time of a crisis like this. So that legal authority already exists, but it's not currently being exercised. And this is one that I think is a little bit more nuanced, which is why I'm glad that we're talking about it. Because it's there, right? It's an option. But you have to be careful about when you're going to use the government to take over private employers and direct the production of certain things. But it's not unprecedented, though, now, is it, Lance?
No, not at all. I mean, Ford Motor Company did it as far as creating Jeeps and airplanes and everything else for World War II. I guess what I would like to see is I'm the president and I can offer a company, I would say, you know what, if you want to start making me surgical masks or gloves, and this is the style, this is what we need, and you can get me, how many can you get me in a week? Okay, this is what I'm willing to pay. I mean, as a private company, as an entrepreneur, if I knew that there was money to be made for that, then of course I would have my employees do this. And you say, well, why can't people just do it? I agree. I mean, I'm starting to think, what if, they shipped us as each American enough material or whatever to make 10 masks. We all sat down and made 10 masks and shipped them. Would that make a difference or not? And I'm not, maybe that's not even a drop in the bucket, but I was telling you how I was watching the John Adams series, and there was Abigail Adams during the American Revolution making musket balls with her children in the living room on an evening. Okay. I mean, at least get a hold of the American can-do spirit and let's see if we can get something done. And that's what I think we're missing, whether we do it through federal law or leadership of the Fed or of the government at the state or local level. Where is that can-do American spirit? You tell us what you need, we'll get it done. And I think we're missing out on that among all of our leaders.
I'm hesitant naturally against, the federal government again, because what happens here is they take, they ultimately take control and tell a factory, this is what you're going to do. And this is how you're going to do it. At the same time, all of the science and research indicates, and one of the things I feel fortunate about, Lance, is that really the state of Ohio, while it was out in front of a lot of this, has been leading the way, trying to be proactive, trying to be overly cautious. And I know that it's an inconvenience for a lot of people. I mean, it's an inconvenience for you and me. Lance and I aren't in the same room right now, and I know that it's even more than that for some people because they can't even continue any type of work, as a result of this. But at the same time, it's the difference between life and death and, being smart and not. And I think that to me is where, when we get into this, I think you're there. I think if we're going to be serious about minimizing the death toll and keeping the curve below the line, if you all haven't seen that chart, you can Google it. It makes it pretty clear. We only have so many hospital beds in this nation, and the last thing we want, and it looks like it's what we're probably headed for, is decisions about who to refuse care to because we can't take care of everybody. Because there's just not enough people. There's not enough staff. There's not enough physicians. It's just, the numbers don't add up. So I guess
and you still have people who are having strokes and heart attacks and
right.
everything else that need those beds. It's not just the coronavirus. And so now you have 5 beds left and you have 10 people who need critical care.
Right. And so
who are the 5 that get it?
And so that to me is, I think we're at that point. I think we have to take the steps necessary to make sure that our medical professionals have the supplies they need, because then you get into, even if I have a bed, if I don't have the resources or if I have to put myself in danger and then I get sick, now we're further reducing our capacity because we can't manage our medical professionals. We can't take care of them. And that becomes, a problem in and of itself. And it's already really bad for anybody that's wondering. A great example is, Lance, Brett, works at Nationwide Children's Hospital, and they've started directing many of their people on the floor, nurses, STNAs, et cetera, to wash and reuse their gloves and masks because they don't have enough. And it's dangerous. I mean, it carries with it inherent risk to do that.
My daughter works as a healthcare professional, and she was checking people coming into the clinic by, taking their temperature. And she works for the biggest employer in the state of Ohio, Cleveland Clinic. And they said, yeah, well, you're just meeting people. You don't get mask or a glove. You just have to take people's temperatures without it, because we don't have, not because they didn't think she needed one, but they didn't have them to give to her. So there she is on the front lines, checking people to make sure that they're not unhealthy to come get care, and no mask for her. Because like you said, they need them for the doctors and nurses that are dealing with sick people. But if you don't, if a doctor or a nurse gets it and they're seeing 50 to 100 patients a day and they're taken out of the game, then that's 100 people that aren't getting serviced. But again, who's come to us? Who's come to, all the people who have a sewing machine? You can't tell me there aren't people who have sewing machines at home who are being, either by the government or on their own accord, staying at home, who wouldn't gladly put together masks if they were given the supplies and the directions on how to. And again, that's that American can too spirit. And you say, well, okay, but so what good would be 10 masks from every home? Well, it's more than you're getting right now. It's going to be some help, isn't it?
And they probably would be. I think there's I think part of what Lance is getting at is whether or not that's the idea, there's options that we're not doing that we should be. I'm sure there's things that professionals would tell us would be problematic with that, but they might be able to figure out ways around them, but not if we're not thinking about it, not if there's not people assigned to that type of, to spend their time figuring out what could people be doing to be more help. And just like if you federalized manufacturing right now, you would have the ability to direct lots of factories that have shut down, that aren't doing anything, to keep paying people to produce supplies that are needed, which is, it's good because the company keeps operating. It's good because they can keep those people on payroll. Those people keep getting paid, and the medical field gets the supplies they need. I mean, it's a win.
And to also redirect the raw materials that are necessary to make said products.
Right.
The government has that ability as well.
And I think it's important to note this law, again, already exists. We're not talking about something new. All that has to happen is the president has to decide to enact this to make it happen. And the law is pretty specific with, this power has to be relinquished once the emergency is passed. I mean, we can't permanently federalize manufacturing, and nor should we. So that's that one. We're going to move on now because we don't have a lot of time left to the two others we've got, which is mortgages. If you have a loan that is owned by the federal government or the federal government's Freddie Mae and Freddie Mac, then you, for now, won't be foreclosed on if you miss your mortgage payment. Same thing with a lot of renters. If the property owner has a mortgage for your property that you rent through those sources, then that is also one of the stipulations the federal government's passing down. Again, I think it's pretty sensible. The only thing I don't love here, Lance, is there's plenty of small property owners out there who own 2 or 3 properties, and that's their livelihood. So
they're living off of that.
Right. So now we've shortchanged a solution again here, which is, well, we're not going to make people pay it, but we're not going to do anything for the small landlords out there that aren't going to be able to get by without those payments, And that goes back to the stimulus package. But other than that, I don't have any big gripe with this. I mean, the last thing that we need to do is kick people out of their homes right now. We don't need more homeless people. We need less.
Right. If your ultimate goal is to get the economy running and to get everything back on an even keel, then you need as many people as possible when we come out of this. And the only way you do that is keeping people alive and healthy as much as you can. And you don't do that by kicking them out of their homes.
A little bit of good news is that the Federal Reserve has signaled that they're pretty much willing and ready to do anything that they need to do on any scale imaginable to end the shortage of money. And that's actually exactly what it is money. This is a New York Times article we've got linked at thestateofus.org, kind of interesting. The Fed, the one entity in the world with the power to create dollars out of thin air, has every intention of doing so at whatever magnitude is necessary to try to reduce the severity and limit the duration of the coronavirus crisis. And that's, again, from this article that we're referencing. So they're preparing to do several things. The other thing they've done is they're signaling that they will buy treasury bonds and mortgage-related securities in whatever quantities are needed. And for those of you that, what does that mean? Why do we care? The first goal of that is making financial markets function more like usual. By buying those up, without getting into the economics of it, the Fed will help make sure that we avoid, a total crash like in 2008. So that's what they're trying to do on that front. And the other side of this is exactly what it sounds like, printing more money to make sure that there isn't a shortage. Now, we could have a whole show on the discussion of the practicality of printing money and what that does to valuation and all that. But I think, Lance, it's at least good to know that they are, they're already thinking about it. They're prepared. They've already started taking action, and they're going to do what they can do to try to shore up or at least prevent total crash of the markets.
I don't have a problem with any of that except for that last part, and I guess we just need to do another show because I am not in any shape or form for the fact of just printing money. And like you said, we're out of time. I'm glad they're willing to do things. Anything short of just printing money to print money, I can support on some level. Can't support that at all, but I know I don't have time to make my argument now, so we'll have to do it at another time.
As everybody can tell, there's a lot to talk about on this, and I just want to stress that Lance and I have discussed this some. We're going to try to keep providing information on this as we feel like we have something different and unique to offer. That's part of what we're trying to do here on The State of Us, Lance. So we don't want to just recycle the same stuff you're hearing other places. We want to provide you something different. So if we don't have something new or something different to say, then we're going to continue with our other coverage of other items, as kind of is our ongoing policy. So hopefully we'll provide you some stuff to listen to and to learn about that isn't coronavirus related, hopefully some relief from some of that. But when we feel like we've got something to share, we'll try to share it. And that all comes in line with our mission, right, Lance, here at True Chat?
That is correct. Yep. And our mission here at True Chat is to educate people by providing honest, open, and respectful conversations. And most importantly, it doesn't do us any good to talk about these things if you don't get your friends to listen. So make sure you let them know that you can find us on Spotify, Stitcher, Apple Podcast, and anywhere else fine podcasts are found.
The State of Us is released on Tuesdays and Thursdays as a podcast, so you can always get the most up-to-date episodes early in the morning on those days. And then, of course, on the weekends, you can find us on select syndicated radio stations around the country. For The State of Us on True Chat in Urbana, Ohio, I'm Justin T. Weller.
And I'm Lance Jackson.
Special thanks to our producer, Bradley Butch. Thank you all very much for tuning in. We'll see you next time. Be the change. Be sure to check out our website, thestateofus.org, for books, articles, and all the ways to tune in. thestateofus.org.